Can Lyme disease stay hidden during a pregnancy and only emerge after childbirth? I'm going to be addressing this question and a number of other questions as part of a Common Sense Lyme series. This question was addressed in an article by Pavia in 2018. The title was Woman Develops Lyme Disease After Giving Birth. So let's begin to address this article, and then we'll go into some of the questions and answers that we can base on that article. Now, this is a 23-year-old woman from Brooklyn with bilateral knee swelling 3 days postpartum. Now, knee swelling is common. That was one of the first presentations of Lyme disease. Now there's a lot of neurologic issues and autonomic issues and so forth. Now, she had the same pain or similar pain at 6 months of pregnancy. No tick, no rash, but that swelling went away by itself. She had traveled to a wooded area in upstate New York. They were able to diagnose Lyme disease with the Western blot. Now, sometimes the Western blot is more accurate, more reliable if it's for a rheumatologic case. So given it was a positive test, it was clear that the patient needed to get treated, and it's always easier to get a paper like this published if the tests are positive. 3 weeks of doxycycline were given. There was full symptom resolution, and a newborn remained healthy with no signs of Lyme disease. Now, the key points is that Lyme disease can be hidden during the pregnancy. It seems like the hormones that you have during the pregnancy can help some of the autoimmune diseases that are out there, and I've seen less symptoms in some patients with Lyme disease, at least during the 9 months. There's no evidence of congenital Lyme disease, but it's difficult to be sure a baby has any congenital issues anyway because they can't give a story. They might not have a swollen joint. It's only later as they age that you might find and wonder, does this Lyme disease or these neurologic or developmental issues relate to that tick bite? So without a tick or without a rash, they made a diagnostic decision to treat. It appears as if doxycycline is effective. They didn't study in the protocol and report in the protocol whether they went further over time to see if she stayed well. Now, the conclusion is that you should at least consider Lyme disease postpartum. In this case, she just happened to have a swollen knee, which made it easier to make the diagnosis. Also, she just happens to have a Western blot with more than 5 out of 10 bands. So this is the reference by Pavia. Now I have several questions I want to see how you do on this question. So, can Lyme disease stay hidden during pregnancy and only emerge after childbirth? In this case, Lyme disease doesn't always cause symptoms right away, but here the Lyme disease can remain asymptomatic during pregnancy and flare up postpartum. Next question is, what symptoms led the patient to seek medical attention? In this case, it was bilateral knee swelling, but sometimes they have to rely on headaches, have to rely on shortness of breath. Shortness of breath is, there's so many causes for shortness of breath, but babesia is one of them, which is a tick-borne illness. Now, when did the patient first experience knee pain? The first knee pain was during the 6 months of the pregnancy, but that was likely the time that she acquired Lyme. That was a classic finding of Lyme disease. Or what did the patient deny experience during pregnancy? There was no tick bite, no rash, which makes it more difficult, but so few people have the perfect combination of a tick and a rash that you're always having to use clinical judgment. Which test confirmed the diagnosis of Lyme disease? As we talked about, the Western blot is there. Now, to call it two-tier by the Lyme test, you should have a positive ELISA. Which of the following is true about newborns? In this case, the newborn remained asymptomatic, but there have been newborns with EM rashes. There's another article where newborns had presented with babesia. The mother got treated for Lyme. There's no treatment for babesia that's approved for mothers, so both mothers had healthy kids, but they came back a month later with babesia. Which of the following best explains why symptoms appear postpartum? In this case, immunologic and hormonal changes appear to be the case, but instead of immunologic and hormonal being the cause by itself, a persistent tick-borne infection appeared to be the cause. Doxycycline was prescribed, and the patient got better. The knee at least stopped being swollen. What treatment was prescribed? In this case, doxycycline for 3 weeks. Now, that might have worked well. It's just that if the mother was breastfeeding, we're always reluctant to give doxycycline to a mother because it can pass to the child, or it might affect their bones, at least the color of the bones and teeth in the future. It's not clear whether doxycycline is always going to be a problem, because the CDC says that 2 weeks of doxycycline given and prescribed to a young child, hasn't caused problems, because they know that because they've been prescribing 2 weeks for Rocky Mountain spotted fever. Amoxicillin has been used, which takes care of Lyme, but if there were a co-infection, it's not very effective. IV ceftriaxone is a therapy, but it's too invasive unless someone really has a problem with the child later on. And what is the key reason Lyme disease was missed during the pregnancy? Is that symptoms can be mild or transient. It cannot occur during pregnancy. So in this case, I'd like to have you look. Now I have a question for you, and you can leave the questions in the comments. What's the key reason Lyme disease is missed during the pregnancy? A, symptoms may be mild or transient. It cannot occur during pregnancy. Tests are always negative in pregnancy, and it always presents with a rash. So I'm going to leave you with that question. Leave it in the comments. And thank you for joining this Common Sense Lyme series, where I discuss cases I've seen in my practice. Feel free to leave an answer to the quiz in the comments below. Have a good day.